So you say you're a teacher?
Yes.
So what do you teach?
I teach 7th grade U.S. history. So this is my 23rd year of teaching. But I'm involved far beyond just the classroom. I'm on the teacher advisory board for the National Constitution Center and wrote an article for a magazine for Mount Vernon. And so I'm a little more involved than a typical teacher.
You're a big deal.
I try to be in my own little room. So.
Can you tell us what a typical day is like for you?
Sure. I get up at 6 in the morning, and I'm off to work by about 7:15. And then I work all day. Twice a week I go to physical therapy. Just lots of different joint issues over the years. And so I finally said to them, hey, can you just help me? I just want to be able to exercise without hurting myself. So essentially, my physical therapy has gone from just being focused on, it was all about my left shoulder at first, but now it's almost like a full body workout. That is what I do in physical therapy twice a week. And that way I'm not hurting myself. They're watching me. They kind of have me on a regimen, and that seems to be working really well for me. So twice a week I do that. And then I have to be done eating by 7. If I'm not done eating by 7, I'll wake up aspirating. I sleep now in a adjustable bed. They wanted me to be in a hospital bed, and I said, no, I am married. I am not sleeping in a hospital bed the rest of my life. So I fought with my insurance company until they paid for a split king adjustable bed, which is lovely. So that's a typical day. But honestly, in bed and asleep often 8:30, 8:45. Like, I don't have a lot of energy after a day of doing what I do. So.
What's your diet like?
What is my diet like? That's probably been more affected. I cannot eat the volume that I used to eat. My digestion is so slow that for me to try to lose any weight is very, very hard. Like, I have to go under 1,200 calories to try to lose weight, just because it just does not empty ever. So I tried being gluten-free for a year and a half, thinking maybe this would help reduce symptoms. It didn't really do anything. And when I went to the specialist at Johns Hopkins, she's like, why are you doing that to yourself? You have enough other things that you're dealing with. Don't do that to yourself. And so I said, hey, if I don't have to be gluten-free, I'm not going to be. So I'm not gluten-free anymore, but I very limited in terms of acid. I have to be very, very careful. And I like smoothie drinks and stuff, and I'll take a sip and be like, yep, nope, you get it.
Yeah, she used to be able to drink Mike's Hard Lemonade.
Yeah, there's no way. So.
What medications are you currently on? How do you
Hot. Thing you asked. So I brought this just so you can see. This is what it's like when you have an autoimmune disorder like scleroderma. So I, years ago, this summer actually, realized going to specialists, going to the number of doctors I go to. So I had to type a list, and now I just have it. It's a Google Doc, so I can edit it on the fly. I can print it out, and then when I walk into a doctor's office, I can just, instead of trying to remember. So do you want the list?
Sure.
Okay. So I take amlodipine for Raynaud's, Celebrex for my joints that hurt so much, Synthroid, that's in my genetics. Protonics twice a day for the acid reflux, along with famotidine, and still have reflux at times. So some allergy medicines. I have to take Linzess, the highest dose of Linzess, along with Metamucil to try to get anything moving. The doctor was like, seriously? Because usually they give a very low dose of Linzess, and people are like, no, get me off it. I can't. Mine, it didn't do anything. And she's like, seriously, it didn't? So I'm on the highest dose of Linzess, and that by itself wasn't enough, so I take Metamucil also. I take aspirin because I'm also diagnosed with antiphospholipid syndrome, and then just allergies. And then we drive to Canada to buy my Gaviscon, which sounds crazy, but they have, what is it?
Alginic acid.
So it makes a foam, and it sits on top of your food. So I do that every night. That's the last thing that goes in my mouth right before I go to bed. And we'll drive to Canada, load up on a bunch of it, come home. So.
The Gaviscon in the U.S. is not the same.
No, it's different.
Interesting. Have you found it difficult to be adherent with all those medications?
No. So I have a pill case set up by my bed. I have a pill case set up for the morning, and I have a pill case for the before breakfast pills. And it's just my routine now.
She
I
used to
can't-
take each pill out.
Yeah, I used to like open all these things, and I was like, so once a week I set it all up, and then I'm done. So, but no, I'm very good because you feel so miserable, especially the acid. Like if I miss one of those, it's like overwhelming me. So, and they have tried me on, like this doesn't include all the medicines we've tried and said no. There's a lot of antidepressants that they're finding help with the stomach sphincter closing. And also help with reflux and stomach emptying. So I've tried a bunch of that, but I'm really prone to nightmares, and so so that was.
And he's laughing.
Well, it's because in the
Well, one
nightmares,
of them's
like
supposed to help her sleep, so she stopped taking her cyclobenzaprine so she could take this, and instead all she's doing is dreaming and having nightmares.
yeah,
So it doesn't matter if it's 10 hours, she still doesn't sleep.
yeah.
Yeah.
So it seems like you have a lot of social support.
I do. I
Husband.
do. So and I also started a group at our church. We're pretty involved in our church, and we have a group called Empowered, and it's all people with chronic illnesses. And we just started it, and we have like 10 people already involved, and it's just to encourage one another, like share verses, share prayer requests, like how can we help you, and then linking with some of the church's resources, like we have a meal ministry and we have, a building ministry. So like if somebody needs a ramp, we could get them a ramp or, handles or whatever. So it's pretty cool that
Awesome.
That is really great.
God's using something pretty awful in my life to actually help other people. So
Are there things that you used to do that you have an especially difficult time doing now?
Bending over.
yeah, I can't bend over after eating at all. Like it just, to bend over, because my esophagus and stomach don't work right, I can't do that. I can't stay up late like I used to. I just don't have the energy anymore. I used to be able to, you go out with friends and have a drink or have a snack, or I can't, nothing goes in my mouth after 7 p.m. It just can't. If I do, I feel really sick. We took students to Paris and London this summer, and there were a couple different nights that we just, one night I just had to not eat the dinner because there was no way dinner wasn't till after 7. So, and a couple different nights because I wasn't in a hospital bed, I had issues with aspirating. So,
Are there some things you do to try and conserve your energy throughout the day, like rest breaks or?
so I teach 7th grade.
Yeah, so there's so that
Not
answers
a lot of
my
rest
question.
breaks.
Yeah.
I think I'm more cautious. Have you guys ever heard of the spoon theory? That you only get so many spoons in the course of a day, and if you use your spoon for one thing, you can't use it for another. And so I think I'm careful about how I spend my energy, and there will be times that I'll he's left. I'm pretty involved in a lot of different things. But I try to, there are times that I'll just realize, okay, I can't do anymore. I need to stop. So, and my body will tell me because I'll get sick. So,
And that happens a lot.
yeah, much more prone
She's
to
been on
illness.
antibiotics a lot.
Yeah.
It seems like you deal with it pretty well. You're in a lot of things, you're active
Yeah.
with it and everything. Like, if you had to give advice to someone who's first diagnosed, what would you say to them?
I would say to really stay on top of it with doctors, to get yourself organized. And I found Dr. Shapiro online. And if I hadn't found him online, I would probably only be seeing the rheumatologist in Syracuse, which would mean I would likely, if I were only listening to them, I would likely be on an immunosuppressant, which would totally change my life. Because if I was on an immunosuppressant, then my job, should I really be in the classroom with all those kids that are sick, and so I think really being proactive with your disease is really important. And, we both read a lot about it, and I also have found that you can't just focus on the negative, and I sometimes get in that trap that, oh my goodness, I'm going to end up with a feeding tube. Well, if I'm going to end up with a feeding tube, darn it, I'm going to eat all the chocolate I can right now, or different things. But you kind of learn, Like you have to learn what to accept and what, you know what, it's not yet. So kind of learning to, okay, I'm going to do what I can now. And that's part of why I'm so involved in the things I'm in, because I can do it right now. I don't know what 5 years from now looks like. So, and that's the hard part.
And she used to be even busier.
Yeah, I was way more involved even than I am now. So.
How do you feel that your life or your role as a husband has changed since her diagnosis?
She was diagnosed before we were married.
He knew what he was getting into.
Well, I thought I knew, but at that time, she was basically on no meds for it. Had been diagnosed, but the first few years, depends on where you are in the process, she didn't really need anything. But for me, it just has more to do with the unknown of, could she be around 5 years from now or 25 years from now? Because it only takes one complication to really take her life. So that's helped. It's affected me psychologically so much. I definitely developed some anxiety. Could be related to that, we're not sure. We were also foster parents for a while, which is when her symptoms really started to manifest.
Like stress.
Oh,
Stress.
it was very
Lots and lots
stressful.
of stress.
So now we're just dog parents.
Oh, those are the best parents.
Yeah. We're getting our second dog tomorrow night.
Oh, that's so
So
exciting.
we're rescue dogs. So right now we have a miniature schnauzer, and then we're getting tomorrow night. He's like a
Something
poodle-y,
that looks
schnauzer-y,
kind of like him. Yeah.
adorable. So
Now you said something about seeing a doctor in Syracuse. Are you not from around here?
no, we're from Syracuse.
Oh,
So
thank you for coming all the way
Yeah.
here.
We both grew up in the Glens Falls area.
yeah.
Okay.
So Glens Falls is home.
Yeah.
I live like near Lake George, like Whitehall. Do you know Whitehall?
Yeah, I know Whitehall.
Yeah.
So did you know the Benjamins? Les and Kitty Benjamin?
I know. Yes, yes.
Okay, they are my godparents.
Oh,
My parents
no
used to live in
way.
Whitehall.
Small world.
So
I know Blake. You know Blake, Benjamin, all them, the younger ones.
I don't know any of the younger
Okay.
ones. I just know the parents.
Yeah. Oh my gosh, it's so
So.
funny.
But yeah, so yeah, we go to Johns Hopkins. That was one question the other table asked how many doctors I see. So I see 3 rheumatologists. I see one in Syracuse just to have a local connection. I see Dr. Shapiro just because he's phenomenal. Like his brain is incredible. And he referred me to a doctor at Johns Hopkins, and she's amazing also. She specializes in the gastrointestinal part, which is obviously the part that I need the most. So I see her. Then I see a pulmonologist, and I see a pulmonary hypertension specialist at Hopkins. I've not been diagnosed with that yet, but they think it's coming. So I see him every 6 months. I go to Johns Hopkins, and I see both of them when I'm there. One only sees patients on Tuesdays, one only sees them on Wednesdays, so we go and see both at the same time. So.
That's in Maryland, right?
Mm-hmm.
Baltimore. It's not in a nice area.
Yeah, I've heard.
So pulmonologist, rheumatologist, orthopedic. I see often. Gastroenterologist is very important. I get my esophagus stretched every 6 months or so. And then, who else do I see? I have them on the list here. And then just normal doctors every woman sees in primary. So, other questions for me?
Well, you've also seen a hematologist.
Yeah, so I have, when you have one autoimmune disorder, usually they travel in packs. And so several years ago, they kept seeing my